today I'm going to show you how to set up a bed and how to do what we call a plain manual facial, where we just cleanse and tone and massage and tone. The first thing that we need to do before we do anything is disinfect and sanitize our hands. As you notice on my dispensary here, the first thing I'm going to do, because I'm from the old school, is wash my hands. We have to make sure that this is done. Coming over here, we have two beds that are made, okay? These are for clients. We have two sheets. One goes on the bottom and one goes on the top. Here's the bottom sheet, okay? And one goes on the top with a blanket. We have a bolster that our clients' legs go under. They can either have them at the bend of their knee or they can have them a little further up depending on if they have a back problems or whatever, okay? We have 3 towels. We have a towel that is folded like so. This is for our head drape. And we have another towel so that we don't get a lot of products or masks on the sheet. The towel that is out here, that's for us to wipe our hands on, okay? Then we also have a steamer and we have a mag light. In our steamer, we have what's known down here as a water well, okay? This is our water well. It has a red line, which is where you want to take the water up to and not past. It also has a gasket that's in it that has to be put in there just right, because if it's not, it's going to leak out. And in order for us to have steam, this water that is in this water well has to become to a boil, and the boiling point is 212 degrees. We don't want that to get on anybody's skin. You can totally get a 3rd-degree burn from 212 degrees water. Okay, our on and off. This is a mag light. This mag light allows us to have a 500 magnification of the skin, so we can analyze the skin. We can look at the pores. We can see if they have a lot of comedones, if they have melias. We can see if they have dry skin, flaky skin. This is a wonderful tool for you to use. Get used to using your tools because it will make your job so much easier in analyzing and understanding skin structure. We have our chair that the estheticians can sit in. We also disinfect and sanitize everything once we've got our client off the bed. We have our little trolley. On each one of the trolleys we have a hand sanitizer. We have our clock, which tells us what time it is, which tells us we can set timers. Like some of our products we have to time, so we set timers. We have cotton, Q-tips, things that we need. We also have a hot towel caddy. Our hot towel caddy, we put wet towels in there, close it, turn it on, and our towels will become really warm and steamy. At the end of the day, or when we're all done, we have to keep it open, okay? Because if we close it at the end of the day, it gets too much moisture in it. And each one of our beds have a little waste container, which looks like this. And if you notice, I haven't touched anything, okay? Which looks like this. So we just drop things in. We usually put a plastic bag in it so that we can just empty it. Over to my left, okay? Oh wait, let's back up here. We have our basket, a towel, and a client's body drape that they're going to use. We have a dressing room out and around to our right, and they put their shoes and their clothes and everything in here, and that goes underneath the bed on the shelf, okay? When she comes back and hands it to you, it goes under. Then we help her get into the bed, cover her up, get her all draped up and ready to go. We have distilled water. Distilled water is what we use in our steamers. We also have a microdermabrasion machine here. This is done with crystals or it's done without crystals. So it just depends on the type that you have, the type that you want. This is our 7 unit. The first unit here is a brush unit. Then we have our vacuum spray. Then we have our high frequency, and our galvanic. These knobs here are called rheostats. What they do is they make sure that we have how much electricity or whatever we're doing is flowing through to the client's body. We always want to make sure it's on 0.
Okay.
That's the first safety precaution that you want to take when you walk up to any machine, is make sure that all your knobs are at 0, because you don't want to, shock anybody. Okay? This, my friend, is a brush unit. This is what helps to exfoliate the skin. It rotates at different speeds, and you do it to the client's comfort. You put an exfoliation on their skin, like a scrub or something, or a deep pore cleanser, and then you use this and you go around usually twice, and that's it. Take this out, and it goes right here so that we can disinfect it. Okay? Our high frequency, that is our third one. Okay? We have different glass electrodes. We have a spoon, we have a mushroom, we have a pointer. What this does is it disinfects the skin with an ultraviolet rays gas, and with an argon gas, with an argon gas. So it helps to germicide the skin after extractions. Okay? This cannot go into a disinfectant solution. We have to spray it with a disinfectant spray, wipe it down, spray it again, and wrap it up. It doesn't go into the disinfectant solution because in here, where the metal meets the glass,
Yep.
you will get disinfectant solution in there.
Inside.
And then when you put it here, it will blow up. Okay? So you have to be very careful. You have to think safety with these. If you learn your safety procedures, there's nothing to worry about. If you do them like we teach you, there's nothing to worry about. These are very safe. Students have asked me several times, if I'm going to buy a machine, what's the one that you would recommend me buy first? High frequency. Because your high frequency can do a number of things. It can germicide the skin, it can kill the skin with your argon gas, which is purple, or you have another gas, which is neon, which is pink, which germicides the skin as well, but it calms and it soothes and it pushes product in. So this is really an all-purpose machine. So if I'm going to advise anybody to purchase one machine, it would be this one. Argon and neon with your glass electrodes, okay? And you can't tell by looking at this which one it is until you turn it on. This could be a argon gas, and you only know when you turn it on that if it's purple, it's argon, if it's pink, it's neon. But they both fit into the same unit, okay? And usually when you buy one, you get both colors, okay? And you can buy portable ones, which are nice. I have a portable one. It's really nice, but I couldn't find it this morning. I probably put it in the top of my closet, okay? Be very careful when you go to pull these out. Make sure that you grab a hold of it so that you've got it secure, and then twist and pull. Put it in, push, and turn. Okay? Hold on to it, turn, and pull. That way you're not going to break anything. Okay? All right, moving over. So now I have to disinfect my area.
Okay.
So what I'm going to do is we can either use disinfectant wipes or we can use a spray disinfectant to disinfect. So I'm going to use a spray disinfectant wipe. Okay. Close it down. I'm going to disinfect my chair because I don't know who sat on it last. I'm going to take a paper towel, and this is going to be my SMA, and those letters stand for Sanitary Maintenance Area. This is where I'm going to put my tools that I'm going to use. If I have a spatula, if I have a plastic stick, whatever I'm going to use is going to go on there, okay? I have my cotton, which goes there. I have my palette, and this one has 6. You also have round palettes, and you can get these at like Michael's. I love these. because they give you just enough product. That way you don't overuse product. In this business, especially with professional products, a little bit goes a long way. I put my hand sanitizer back down and I put my toner down. Okay. Now we have our products. I have a spatula, I have my cleansing cream, and I have my massage cream. Okay. Now, cleansing cream is different than a cleansing milk. A cleansing cream has more oils in it. It's formulated with oils. Cleansing milks are formulated with water. So cleansing creams are more for dehydrated, dry skin. Cleansing milks are more for all types of skins. In your professional products, they have a cleansing milk for normal to dry, normal to oily, normal to acne, normal to sensitive. True sensitive skin, no matter what you put on it, it's going to react. You can look at it and it's going to turn red. Okay, and that's what I call a true sensitive skin. So, now I'm going to take and set up my bed. So I'm going to set her up. And I'm going to put a towel down. Okay. And I'm going to take another towel and I'm going to fold it in half. And I'm going to put it right here so that I can wipe my hands on it. Okay. I'm going to take my next one and I'm going to fold it from corner to corner. There we go. Okay. And I'm going to place that right here. Okay. Now we always have to cover our client, but before I touch my client, I'm going to sanitize my hands again, because I want my client to know that I'm being really safe. I'm going to put my hand on her neck, I'm going to put my hand on her head, and I'm going to bring her back. Okay? Just as if this was a real person. Okay? So now we're going to come up and over and up and over, and we're going to come here and I'm going to tuck. And I'm going to pull this back to her hairline. Okay? And State Board says we have to leave the earlobes exposed. Okay? So we take our next towel and we put it right under the décolleté, right under the collarbone, okay? Because our collarbone is right here. So we put that right under there, and that is our point of stop. This towel right here is your point of stop. You don't go past that towel, okay? That's because you want to make the client feel really safe, okay? Now we can look at her skin, we can analyze it, we can pull it up, we can see if she's dehydrated, we can see if she's got large pores. Usually acne comes in the chin, blackheads come in the chin, congestion comes in the skin. Around the nose, we have usually more comedones, more melias down on the end of the nose here, okay? Usually in through here. The forehead is usually thinner because the forehead is skin over bone, where we've got more meat and muscles down in the cheeks, okay? Our cleansing facial, we use tissues, okay? And we fold them from one corner to the other corner. Okay, these are going to go on my table and I'm going to place them right there. Okay. Again, I'm going to disinfect my hands. Now I'm going to take, where's my spatula? This is really thick. Lids always go facing up. And I'm going to put some cleansing cream in here. And always cover your things back up. And I'm going to take my massage cream. I need a little bit more than that. And that's going to go. And if we put them in the order that we use them, it makes it so easy. Okay? Now I'm going to take one of my tissues and I'm going to wipe off on a tissue, or I can wipe off on my towel, whatever one I want. But before I place anything that I've used in a product back on my SMA, I have to wipe it off, okay? Because that keeps this area very clean. This gets thrown away. The first area we're going to cleanse is the eyes, then the lips, then the general face, and the neck. I'm going to take 2 cotton balls. I'm going to take some product, okay, and I'm going to put it on my cotton ball, and I'm going to put the 2 together. It's important, guys, that you learn to use both hands simultaneously, okay? So the first area I'm going to cleanse is her eyes. Now, if she comes in after work, she's going to have makeup on. So a lot of times what you can do is just set this on the eyes to kind of soften the eye makeup. This person doesn't have eye makeup on, so we're just going to cleanse. So I'm going to start at the brows, and I'm going to do circles towards me. And I'm going to go under her eyes and around, back up, under, around, back. This is what I call a figure 8. Okay? And everything we're doing comes towards us. Okay? That gets tossed. Some of my cotton. I'm going to put some cleanser. And on the other piece, I'm not. So I'm going to come and I'm going to do circles from her lip underneath on the top. Okay, I'm not going to go in the crease of her lips because that tastes terrible. Okay, so you want to make sure that you get that off. Then we can come and go and remove. Okay, and that goes in my trunk. Wait. Now I'm going to take some more of my cleanser. Okay, because now we have to cleanse her face. Okay, so. And you're going to notice, students, that I'm going to warm it up a little bit in my hands because it's very thick, so I want to warm it up. And from now on, I'm going to apply all my products the same. Mm-hmm. Get in that routine. So I go across the forehead, down the nose, across the cheeks, across the chin, down up on the neck, and across the shoulders. And the décolleté. Okay. Now I'm just going to work it in, okay? So I'm going to do circles towards me. Okay. Down on the nose. And everything comes towards us, okay? We don't want to go the opposite direction. We're going to split the chin. I'm going to go around her nose, under her mouth. I'm using my 2nd and my 3rd fingers. The reason why I'm using my 2nd and my 3rd fingers is because they give us the most even pressure. Okay? I'm stopping at my facial nerve, which is right here by her ear. Okay? And I'm going to come over here, and I'm going to work this cleanser up. Now here I can use my whole fingers, okay? And this is done vigorously. Back to my facial nerve, split the chin again, circles across the cheek, up on the nose, and to my temporals. I don't go over the eyes because I've already gone there. Here, to my facial nerve, back behind to my cervical vertebrae, come down and feather off. And we are done. Now I have to remove my cleanser. So what I'm going to do is I'm going to place my hand straight up on my tissue and come over and over and down. Take my little finger out and I'm going to come with my tissue and I'm going to bring it over and over and down. Now, this is tissue. It's made of wood fibers. Okay, we don't want to scratch the client's skin, so we want to come everything to us very gently. and everything comes out. Down and out. We can come up on the nose and out. If this gets full of tissue cleanser and we want to change it, we can. If we want to turn it, we can. If we want to get a new one, we can. So now, after we've taken off all our cleansing cream, we're going to tone. Our toner does 3 things. It removes the residue of the cream, it tightens the pores, and it balances the pH. The pH of the skin is 4.5 to 5.5. 2 cotton balls. I'm going to take my toner. I'm going to come over my waste container. And I'm going to put my toner without touching the nozzle to my, I'm going to squeeze it out just a little bit, okay? Because I don't want to drip it, okay? So now we're going to kind of pat and rub at the same time. And if you notice, I'm leaving a little bit on there, and that's okay, because I'll show you how we're going to do it. Remove it. I'm going to take a tissue, and I'm going to pat. Okay, and everything comes down. Okay, that gets thrown away. So now our next step is our massage. So I'm going to take some of my massage cream. A good portion is just enough so that you have enough slip, okay? So that your hands glide, so that your hands don't stick, so that they glide, okay? And you're not pulling the skin when you go to do a massage. Now, a massage should be slow, smooth, and rhythmic. Okay, this is the part that the clients love the best. Okay, and I'm just going to work my massage cream in a little bit. I haven't started my massage yet. Okay, this cleaning is very vigorously. Okay, toning is patting, and massaging is smooth, slow, smooth, and rhythmic. Okay, so I'm going to place my left hand on the forehead, my right hand on the chest. I am going to bring my hand, my fingers down to my temporal nerve, and I'm going to vibrate, okay? Some people like to shake. I hate that one. And I like to just press with a little bit of pressure in circles, which makes it much easier. Then I slide down to my facial nerve and do the same thing. Come around, and I'm going to do 1, 2, 3, 4, 5, 6, 7, and I'm going to cup and knead. 1, 2, 3, and we never ever break content. Okay. Go across to the 7th vertebrae, and I put my fingers one on top of each other. So my fingers are one on top of each other, and I vibrate or do circles on each one of the vertebrae until I get to the occipital, which is at the base of the neck. Then I'm going to put my thumbs at the facial nerve, and I'm going to come and I'm going to pull at the occipital. Then I'm going to come right around to my facial nerve, vibrate, and I'm going to slide back down, and I'm going to do that again. 1, 2, 3, 4, 5, 6. Cup and knead. 1, 2, 3. Across the back to the 7th vertebrae, to the 6th, to the 5th, to the 4th, to the 3rd, to the 2nd, to the 1st, to the occipital. Place my thumbs at the facial nerve and pull with just my fingers, not my thumbs, and come right around to my facial nerve. Repeat it. Slide down the neck. 1, 2, 3, 4, 5, 6, cup and knead, 1, 2, 3, 1 to the 7th vertebrae. I'm going from bottom up, yes, up to my occipital, and pull with just my fingers. And when I do my fingers, I come this way with my fingers. So I'm coming right into the occipital, okay? But if you notice, I didn't break contact. You don't want to break contact because that takes, and it takes the relaxation away, okay? So now I'm going to come to my facial nerve, okay? I am now going to stroke the platysma, which is the neck. So I'm going to go 1, 2, 3, 4, 5 in the center. 1, 2, 3, 4, 5, and right. 1, 2, 3, 4, 5, and back to my facial nerve. Now we do that 3 times, so now I do it again. So I start on this side so I remember where I'm at. 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5, and back to my facial.
So you're covering the entire neck?
I covered the entire neck. 5 on the right, 5 in the center, and 5, and it's 15 times. Now I do one more time here. 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5, and back to my facial nerve. From there, I'm going to slide to the mental, which is the center of the chin, and I'm going to press. And I'm going to do circles up the jaw. 1, 2, 3, 4, 5, 6, 7, 8. To my facial nerve. Slide. 1, 2, 3, 4, 5, 6, 7, 8. Again. Press. 1, 2, 3, 4, 5, 6, 7, 8. Now I'm going to split the chin, which means I'm going to come to the center, separate my fingers, and 1, 2, 3, 4, 5, 6, 7, 8, and back to my facial. Again, 1, 2, 3, 4, 5, 6, 7, 8. So far, all the movements that I have done have been effleurage. Okay. Okay, so now I'm going to, at the chin, I'm going to do half C's around the mouth. When I get to the corners of the mouth, that's the buccal. I'm going to slide over and come back to the buccal. I'm going to go rotate to the corners of the nose and press. I'm going to do 3 baby circles. 1, 2, 3. I'm going to do 3 medium circles. 1, 2, 3. And then I'm going to do 3 large circles, turning my hands. 1, 2, 3, and back. Slide to the mental. C's around the mouth. To the buccal. Slide. To the corners of the nose. 3 babies. 1, 2, 3. 3 mediums. 1, 2, 3. Hands up. 1, 2, 3. Because you're lifting. Okay? It'd be much nicer on a person. Okay? So from there, we're going to slide up to the temporals. We're going to rotate under the eyes, which is the malar bone, to the infratrochlear, which is the corners of the eyes. We're going to come up to the eyebrows and we're going to pinch 1, 2, 3, 4, 5, 6, and back to the temporals. Clients love that one for some reason. Rotate under the malar bone to the infratrochlear, which is your tear duct, and press 1, 2, 3, 4, 5, 6, and temporals. Again, rotate under the malar bone to the eyebrows and pinch 1, 2, 3, 4, 5, 6, and back. Now some students will say, Miss Chapman, can I use my index finger instead of my second finger? Yes, you can. It's whatever comfortable for you. I just use my second one because that's the one I'm used to using. So from there, we're going to stroke the corrugator. The corrugator is the bridge of the nose. So we're going to go 1, straight up, 1, 2, 3, 4, 5, 6, and then we do a crisscross. 1, 2, 3, 4, 5, 6, and vibrate. 1, yeah, everything comes towards us. 2, 3, 4, 5, 6, and crisscross. 1, 2, 3, 4, 5, 6, and vibrate. You guys want to make money? Because I sure do. So if you want to make money, all your massage movements come towards you. So now we're going to rotate under the malar bone to the infratrochlear, and we're going to rotate down on the procerus. The procerus is the nose. That's the only place that we rotate down on. When we get to the corners of the nose, we rotate in circles back towards us and slide back to the temporals. Again, under the malar bone to the infratrochlear, rotate down on the procerus, circles to the end of the nose, and slide back. Rotate under the malar bone to the infratrochlear, rotate down, circles, and slide back. Next, we're going to do a up heavy, down light. I'm going to bring my right hand to my left side or my left hand to my right side. It doesn't matter. But we're going to come up heavy and down right. At heavy and relax. Heavy and relax. Heavy and relax. Okay?
So when you are saying heavy, that means you are putting pressure and bringing up?
Right. When I am saying heavy, I'm coming this. See my fingers? See what my fingers are doing? And then I relax and go down. Heavy and down. Heavy and down. Heavy and down. And then to the temporals. Next, we do the headache movement. Now be careful with this one, because if you've got too much pressure, you can give a client a headache. If they've got a headache, you can relieve it. So you're going to take your palm and you're going to put it on her forehead. You're going to place the other palm on top of your forehead, and you're going to press and slide. Opposite hand, press and slide. And we do that 3 times. Okay. Then we go under the malar bone to the infratrochlear, and we go right under the eyebrows and right under the eyes, and we slide across. The reason why we do it that way is because some people have contacts in. You want to be very careful. So the one question that you want to ask clients is, do you have contacts? Can they be taken out? If they can't, be very careful when you go over their eyes. Okay? Under the malar bone to the infratrochlear, press, and across under the brows and across. Okay? From there, so we're at the temporals. We're going to come down to the facial nerve and vibrate. We're going to go behind the neck to the cervical vertebrae. And we're going to come down, turn our hands up, and feather off. We never just want to pick our hands up from anybody, because that is too abrupt, and the client could be relaxed or she could be sleeping and it could scare her. So we always want to feather off. We always want to go to a facial nerve or a temporal nerve before we pick up our hands. Okay, so now what we're going to do is I'm going to take my tissues, okay, and I'm going to remove some of this massage cream. Okay, and I start at the forehead, and I go out and down. Now I want you to learn, this is just your basic massage, okay? This is just a basic facials, okay? As we go, we're going to incorporate deep pore cleansers, we're going to incorporate scrubs, we're going to incorporate high frequency, we're going to incorporate extractions. So as we go, we're going to add things to this. Once you get your license and you get out into the field and you get into maybe a different professional product than what we have, they have their own ways of things that they like to incorporate, whether it's a serum, a deep pore cleanser, what it is, and then you learn their protocol. Their protocol is their type of facial. We're done, okay? So we help the client sit up. We remove the drape, okay? We fluff up her hair. We take this off, and I always tell them, especially if it's somebody that's a little older, you know, just sit there for a few minutes, dangle your feet, and then I will help you to the dressing area. Because a lot of people fall asleep when they are having a facial, and you don't want an elderly person or a person in their 50s to get up and walk too fast and maybe be dizzy and stumble. So I always tell them, take your time, sit there for a few minutes and that. Okay, now we set our client up. We're going to help her over to the thing, but then what I do is I usually ask the client, how was my touch? At any time during the facial, did you feel like I did not want to do you? Because your touch is very important. Your touch says to this client, she likes what she's doing. She wants to make me happy. She wants to make me relax. Or it'll say to the client, I don't want to do this. I don't feel like doing this. I'm tired of doing this. I wished you hadn't have come in. And that's not going to get you a good tip, okay? That's not going to get that client to come back. So what you want is you want repeat clients. So you want everything that you do for this client to make her feel very, very special on your bed. Like she's the only one that you have in mind that day, okay? So now we've helped her over to the thing. She's getting dressed, and we're going to clean up. So what we do is we take this, okay? I'm going to take my massage cream. I'm going to remove it out of here with my tissue, okay? I'm going to come over here and I'm going to throw this away. Okay. I'm going to bring my spatula. This gets thrown away because I didn't use it. Anything that doesn't get used gets thrown away. This, our bedding, our sheets, our towels, gets put this in here. I'm going to put that in here. Okay. All my sheets and everything go in there. I'm going to take this over to my sink,